Good day, viewers. Welcome to DDM House News Update on our program, Your Health, Your Wealth. I have to remind you guys to subscribe to our YouTube channel. That is Diaspora Digital Media to get the latest. So what do I have today? The Chairman and Chief Executive Officer of Kasuna Global Imaging Limited, John Chibu, on Thursday raised concern over medical tourism among Nigerians, attributing it to poor access to quality healthcare within the country. He stated this at the launch of the company's medical imaging program and diagnostic equipment in Nigeria, in partnership with the U.S. Embassy in Abuja. Chiwo emphasized that Nigeria must reverse the current trend of outbound medical tourism, urging stakeholders to work towards transforming the nation into a destination for healthcare excellence. Wonderful. He said, we need to reserve this trend. We need medical tourism to come into Nigeria, not the other way around. We need to make quality healthcare accessible to all, not just those who can afford it. I agree with you. Chibo explained that the company's mission is to make quality healthcare accessible to all Nigerians. The CEO highlighted that the company is committed to localizing Nigeria's healthcare system by recruiting and training Nigerian professionals. We need to build capacity in Nigeria. We need to learn. We need to train our people to take care of our healthcare needs. That's why we are recruiting Nigerian engineers and healthcare professionals to work with us. With Kasuna Global Imaging innovative approach, Nigeria's healthcare sector is poised for a significant transformation, making quality healthcare more accessible and affordable for all. The Foreign Commercial Service Officer, U.S. Mission in Nigeria, Blake Murray, described the partnership as a powerful accelerator in Nigeria's healthcare modernization efforts. He noted that strategic partnerships between U.S. companies and Nigerian institutions can improve patient outcomes. Yes, it reduces costs, expand access to healthcare, and advance disease prevention and control. The U.S. mission in Nigeria is committed to deepening bilateral trade relations between the two countries. Last year, two-way trade between the United States and Nigeria hit a record of $13 billion. You can imagine. Our shared goal is to promote two-way investment and deepen commercial ties between our nations. The U.S. Department of Commerce and Nigeria's Ministry of Industry, Trade and Investment are set to launch the United States-Nigeria Commercial and Investment Partnership next month in Abuja, prioritizing collaboration in agriculture, digital economy, and infrastructure, including healthcare infrastructure. This partnership is expected to unlock new opportunities to economic growth, job creation, and technological advancement in Nigeria. By working together, the US and Nigeria can address pressing healthcare challenges and improve the lives of millions of Nigerians, Chibo added. He also stated that the investments by Kasuna Global Imaging is a testament to the growing interest of US companies in Nigeria's healthcare sector and demonstrates the potential for mutually beneficial partnerships that can drive progress and prosperity in both countries. Next, Renaissance African Energy Company Limited has donated 7 multi-million medical equipment and drugs to the intensive care unit of the River State University Teaching Hospital, Port Harcourt. The donation includes 4 VG70 ion-made ventilators, a laser therapy machine, an automated external defibrillator, a 7A23D electronic suction apparatus, and essential pharmaceuticals. The company's General Manager, Relations and Sustainable Development, Mr. Igo Weli, disclosed this during the handover ceremony in Port Harcourt. Weli said the donation was aimed at strengthening the hospital's capacity to handle critical care, adding that the initiative was promoted by the hospital's need for essential equipment. He stated, the company, in partnership with its joint venture partners, NNPCL, Total Energies, and Eni, responded by expanding the scope of their support. The donated ventilators were originally acquired and set up as part of the company's COVID-19 response, but had remained unused. Despite having a 9-bed ICU, the hospital currently operates with only a few functional ventilators, a limitation for a facility serving such as a large and growing population. The demand for critical care has far outpaced the hospital's equipment capacity, often forcing clinicians into difficult ethical decisions, choosing which patients receive ventilation support and which patients must wait, sometimes with life-threatening consequences. Well, recognizing this urgent need, Renaissance African Energy Company Limited, in collaboration with our GV partners, steps in. Well, it continued. This donation aims to relieve the burden on resource, that is River State University Teaching Hospital's ICU, enhance critical care services, and ensure that no patient is denied the life-saving support they urgently require. Wow. The multi-million naira seed stocks drugs will support the drug revolving fund at Research Community Linked Health Facility, the Port Junction Health Center. This will enhance the regular supply of drugs and commodities, preventing the out-of-stock syndrome that has plagued healthcare facilities. Well, commended the management and staff of Research for their commitment to excellence in healthcare and education, and urged the management to ensure the equipment are properly utilized. Really added, while this donation is a major step forward, its continued success depends on all of us. I think he made a very, very wise statement. Of course, we are all included for the success of this. So he added, I urge the hospital management and healthcare professionals to ensure proper utilization and proactive maintenance of this equipment. Continued building of capacity of medical staff to maximize the potential of this technology and promote collaboration with other institutions to improve critical care services in the region. At Renaissance, we are committed to supporting excellence. We have seen that excellence is action at research, and it is our honor to support this hospital's continued success with this donation of life-saving equipment and medications. Speaking, the Chief Medical Director, River State University Teaching Hospital, Professor Chisimdo Aleko, thanked the company for the donation, saying it came at a crucial time. Aliko said, we are a teaching hospital on an upward trajectory. We are a teaching hospital that in the last 18 months, our bed space capacity has moved from 300 to 500. You can imagine that. Truly, it is growing. We are a teaching hospital that is particularly committed to delivering excellent health care along with research and training. While appreciating the company, he added, your thoughtful support has come at a crucial time, and we believe it will undoubtedly strengthen our capacity to provide quality care, including life-saving medical procedures, especially in the context of critical care to the people of River State and beyond. Kudos to the Rivers. We look forward to a continued partnership with your esteemed organization, and we assure you that the donated items will be used efficiently and for the benefit of those in need of them the most, he said. Up next, the Niger State Governor Mohammed Bago has extended maternity leave for women in the state from 3 months to 6 months, saying it will give ample time to care for the babies and themselves. Wonderful. This is really, really wonderful. Wow. The governor made this known during their week's executive council meeting at the council chamber of the government house, Mina, where he announced other announcements for the benefit of the residents. He said the leave extension would help them become more productive when they resume and directed the head of services, Abubakar Idris, to work out modalities for the proper implementation of the policy. The maternity leave aims to protect maternal and child health in line with international best practices. Women will now spend 6 months at home to take care of themselves and their newborn baby. You can imagine. The Commissioner of Information and Strategy, Binta Maman, who briefed journalists after the council meeting, disclosed other measures approved by the Niger State government to improve the lives of the residents in the state. She also said the governor approved 1.3 billion naira to procure 23,000 chairs for the state's primary and secondary schools. Maman explained that the chairs were specifically made to address the needs of pupils and students in public schools. The permanent secretary of the Ministry of Trade and Investment, Hamza Bello, also spoke on plans by the state government to establish a $200 million compressed natural gas plant in Lambata, with the pending signing of the Memorandum of Understanding. He also revealed that efforts were on the way to construct 350 shops at the Abadan Suleja International Market and Motor Park, which he said will revive economic activities in the area, as well as the resuscitation of the moribund Niger Fertilizer Company to enhance agricultural productivity across the state. Well, with all this good news to you all, we come to the end of today's news on Your Health, Your World. Don't forget to click on the like button, share, subscribe, comment, subscribe to our YouTube channel, Dasra Digital Media, to get this latest news.
Healthcare costs are rising, and waiting lists are getting longer. Every year, millions of people travel abroad seeking medical treatments, some for affordability, others for access to procedures not available in their home countries. Countries like India, Thailand, Mexico, and Turkey have become major destinations, offering everything from life-saving heart surgeries to cosmetic enhancements at a fraction of the cost. But while the promise of world-class treatment at lower prices is tempting, the reality isn't always straightforward. What happens if something goes wrong? What legal rights do patients have in a foreign country? And how does medical tourism impact the local healthcare system? Today, we're breaking down the pros, the cons, and the legal complexities of medical tourism so you can decide whether it's an opportunity worth taking or a risk too big to ignore. Every great journey needs strong support. Thank you, M3 Global Research, for being our valued brand sponsor. Medical tourism, is it really worth the hype? Let's explore the benefits. One of the biggest reasons people travel for medical treatment is cost. Healthcare in countries like the US and UK can be expensive, while nations like India, Thailand, and Mexico offer the same procedures at a fraction of the price. For example, a heart bypass surgery that costs $100,000 in the US may be performed for just $10,000 in India. The difference? Lower labor costs, fewer administrative expenses, and different insurance structures. This makes quality healthcare more accessible to those who may not afford it otherwise. A common misconception is that lower cost means lower quality. In reality, many medical tourism destinations have internationally accredited hospitals and highly skilled doctors. Facilities like Bumrungrad International Hospital in Thailand and Apollo Hospitals in India adhere to global healthcare standards and employ doctors trained in the US, UK, and Europe. Many hospitals are Joint Commission International (JCI) accredited, ensuring that medical tourists receive the same level of care they would at home. Long waiting lists are a major issue in public healthcare systems. In countries like Canada and the UK, patients may wait months or even years for non-urgent surgeries. Medical tourism allows patients to skip the queue and receive treatment without delay, making it an attractive option for those in need of urgent medical attention. Certain treatments, such as stem cell therapy, fertility procedures, or experimental cancer treatments, may be restricted in some countries due to regulations. Medical tourism provides an opportunity for patients to access innovative treatments that may not be available in their home country. For patients undergoing cosmetic surgery, gender reassignment, or fertility treatments, privacy is a key concern. Traveling abroad allows them to undergo procedures without social stigma or unwanted attention, making medical tourism a preferred choice for sensitive treatments. Let's take a moment to talk about our brand sponsor today, M3 Global Research. M3 Global Research, founded in 2006 by M3 Inc., connects medical professionals worldwide with valuable paid research opportunities, setting the gold standard in healthcare market research.
Until next time I come your way, I am Nigerian Michael Inizinde. Do have a wonderful, beautiful day ahead. Bye for now.